Hi, my name is Darrell Williams. I'm a social worker with the Brattleboro Retreat, a private nonprofit psychiatric hospital here in Brattleboro, Vermont. I'm here with Ben Jerome Lee today. Ben's a junior at Brattleboro Union High School, and he has some questions for us regarding mental health. Ben, welcome.
Thanks again for seeing me.
You're welcome.
What is meant by mental health?
That's a good question, Ben. Mental health refers to how you feel about yourself and others, and really how you handle the demands of daily life. It's not an absence of problems, but rather it's the ability to balance problems with appropriate coping skills.
Okay. What are mental illnesses?
Mental illnesses are diseases that cause disturbances in your thinking, your feeling, and your behavior. They can impair a person's ability to cope with daily stressors or daily routine. And like other medical conditions, they vary by type, symptom, and severity.
Okay. What causes mental illnesses?
Many mental illnesses are linked directly to a biological origin. They might also be caused by some psychological or emotional reaction to a life stressor such as a loss, a tragedy, a significant change in one's daily routine.
Aren't mental illnesses rare disorders?
No, unfortunately they're not. 1 in 3 Americans will experience a mental illness during the course of their lifetime. Mental illness affects all ages, races, income brackets, ethnic groups, and religious groups.
What is clinical depression?
Clinical depression refers to sadness or despair that lasts several weeks, months, or years, and really impacts your ability to function on a daily basis, to go to work, to go to school, to get enjoyment out of things that maybe you once did, such as recreation, various forms of recreation. So really, it's sort of a long-standing issue. Fortunately, it's one of the most treatable mental illnesses with proper care. And the earlier treatment begins, the more effective it can be. Unfortunately, many are told by family and friends to just get over it. And due to stigma, most people don't seek help because of that.
What are some warning signs of mental illness?
Warning signs. There's a number of warning signs, actually, that could suggest that somebody has a mental health problem. Substance abuse, excessive use of drugs and alcohol is one. Repeated visits to a doctor for physical complaints, aches, pains, where there doesn't really seem to be any physical basis for it. Excessive fears or worries, fears of social situations, fears of bridges, fears of being out in public, long periods of sadness or irritability, major changes in eating or sleeping habits, such as excessive eating or loss of appetite, or not being able to fall asleep at night, for example, or sleeping all day are examples. Excessive anger or violent behavior, and thinking or talking about suicide.
If I felt I had a mental illness, how could I seek help?
Well, there's a number of ways one can seek help for a mental illness. Probably the first place to start would be with your physician to rule out any underlying physical cause. If no physical cause is determined, your doctor might refer you to a mental health specialist in the community, such as a psychiatrist, psychologist, counselor, social worker. And in terms of the care that you might receive, counseling, medication might be recommended to treat whatever the issue is. There's also community support groups and self-help groups, such as Alcoholics Anonymous and Narcotics Anonymous, as well as resources within the spiritual community, such as your pastor, priest, or rabbi that might be able to assist you.
Okay. Is mental health care expensive, and how would I pay for it?
The cost of mental health care varies depending upon the level of care that one receives. Private insurers will cover mental health care treatment. There's also public programs through your local community or state agencies that can assist with directing you to the necessary mental health care that you may need.
Okay. Do people recover from mental illnesses?
Another great question, Ben. Yes, depending on the type and severity of the mental illness. 80% of those affected by depression, for example, will significantly improve or experience a full recovery with proper care. Unfortunately, only 1 in 5 people with a diagnosable mental disorder will seek care, due mainly to stigma. Can you imagine if only 1 in 5 of your friends sought care for a broken arm? Stigma is what keeps many people from getting the help that they need. Negativity and misunderstanding surrounds addiction and mental illness, often creating fear and shame. This can lead to unnecessary pain and confusion. Stigma goes beyond misuse of words or information. Stigma is the use of stereotypes and labels when describing someone. Negative stereotypes are often attached to people who are suffering from a mental illness. No one fully understands how the brain works. It works differently in different people. Unfortunately, society does not accept brain disorders the same way it does orders of other organs, such as the heart or the pancreas. As a result, people who are impaired by mental illness are often misunderstood. This misunderstanding can lead to people with mental illness being mistreated or discounted, and lead to many other unfortunate outcomes that simply are not necessary.
Okay. Well, thank you again for answering my questions today.
You're welcome. Thank you.